Hello, everyone, and welcome to our poster presentation.
Hi, my name is Amy Edmonds, and I'm the social worker here at the Pediatric HIV Clinic, the Bill Holt Clinic at Phoenix Children's Hospital.
My name is Noah Altman. I work with Valleywise Health and the Phoenix Children's Hospital as the Youth Transition Coordinator.
We are so excited to share our poster presentation of Smooth Transitions, a collaborative approach to transitioning youth to adult medical care. I'd like to start with a little background on our program. As we know, transitioning youth and young adults to adult medical care is a difficult process, the high rate of follow-up, lots of follow-up. We know through research that youth who are non-adherent or non-compliant in the pediatric setting also have a higher rate of being non-compliant or non-adherent in follow-up in an adult setting. We have found in our clinic specifically, youth who do not have a support person who is invested in their care in the pediatric setting and does not follow them through their adult medical care. A lot of those youth oftentimes fall out of care. Again, reasons for unsuccessful care transition are complex, multifactorial, and unique to each individual. For this reason, it is important to have an individual transition plan for each youth who will transition to adult care. Thus, we developed the youth transition coordinator role, which Noah's going to talk more about his role. He is a link between the pediatric setting and the adult setting, because I'll tell you a little bit more about his program.
All right, so as Amy said, what makes this program so special is that I get to work with these youth starting at a young age of 15, meeting them and their families so that they can build trust and rapport with me. And in this time, once they get to the point where they're ready to transition to adult care, I also get to follow them to adult care and through their time for at least 3 years so that they get established successfully. So with that being said, these are a few elements of the program that help with that successful linkage. Developing relationships, as mentioned, it's essential for this program to work. We need to have a good relationship with the youth so that I can maintain that trust with them, because as Amy mentioned, lots of them have anxiety about leaving the pediatric setting because they become so comfortable with their provider. And it's my role to help them understand that progressing to adult care is necessary. And so it's also important to work with the families to have these youth become more independent with their care and let the parents slowly release the reins of control so that they can allow their youth to be successful and independent. In my time with working with the youth, while they're at the pediatric clinic, I work on educating and skill building with tools such as the workbook that we've established to have key components to sit down with them, discuss, and activities so that they can learn more about adult care and essentially the adult world. So also with this, I get to help with them with familiarizing them with the adult clinic. So if they choose to go to the Valleywise Adult Clinic, I get to introduce them to the clinic so that they're not going to their first appointment not knowing what to expect. So if they want to take a tour of the clinic, I'm able to show them the facility and the staff so that they know what they're getting into. So this is all crucial and important, and providing this ongoing support after they've transitioned helps make this program sturdy.
So a little bit about our outcomes. Prior to the program, when we did not have a youth transition coordinator and did not have a link to follow up in the adult provider world, because we are a separate entity, the average retention rate for transition youth was 55%. Youth who fell out of care typically fell out of care 6 months to 1 year post-transition, which oftentimes can go to that not establishing the rapport with the new provider, being uncomfortable, loss of insurance, again, multiple reasons that oftentimes we weren't aware of in the pediatric setting. Post-program start, so once Noah came to our clinic and became that link between the pediatric setting and the adult setting, all of our youth who transitioned from January of 2020 to January 21 to the Valleywise Partner Adult Clinic have remained in care, and are undetectable to this date. Of those who've transitioned into the community to other providers, 1 has moved out of state, and 6 out of 8, or 75%, have remained linked to care and are undetectable per report. We've had the ability to follow up with them by phone to see how they're doing and report they are doing well. So in conclusion, longer follow-up will definitely be necessary to evaluate the benefits of the program and determine if retention, care, and viral load suppression persist in the long run. And youth and family are unique, again, emphasizing the need for an individual transition approach with our transition coordinator.
So yes, adapting the work tools to engage the teams, making sure that these tools are team friendly so that it builds the buy-in for them so they're not losing interest with what we're trying to do and work and progress to. So it's very important to make sure that I'm texting with these youth. Texting is a huge tool that's important to make sure that I'm touching base with them on a regular, to make sure that they're doing okay. And so that they know they can reach out to me when they need to. So again, that's all part of building the rapport and trust to make the successful linkage. So all in all, this goes to show that the transition coordinator may play an important role to transitioning to adult care.
Thank you so much for viewing our poster and our presentation. We're here to answer questions through the chat, any questions or comments you might have.
Thank you so much.
Thank you.